All right, so you're getting ready for that healthcare administrator interview.
Hope so.
Well, we're diving deep today to help you really stand out.
Yeah.
We found this YouTube video from How to Become.
Uh-huh.
It's got like the typical interview questions,
Right.
but we're going to go way past just the basic answers.
Yeah, for sure.
Think of it as like your cheat sheet to not just survive the interview, but like
Right.
really show them you're already thinking like a leader.
Exactly. It's one thing to know the textbook answers, right?
Right.
It's a whole other thing to connect those to the real world.
Yeah.
The real world of healthcare administration.
Absolutely.
We're going to dig into those connections.
Perfect.
Yeah.
So they almost always start with that "tell me about yourself" question.
Oh, yeah.
And the video really stresses matching your skills to the job description, which seems pretty obvious, but...
But think about it like this is where you frame the entire interview.
Okay.
You're not just listing off these skills.
Right.
You're telling a story.
Yeah.
That makes them think we need this person on our team.
Oh, wow.
The example answer they give is actually pretty good.
Oh, okay.
But let's take it up a notch.
Okay, yeah. So they mention like being meticulous, a problem solver, good with teamwork.
Right.
All solid stuff, but it's
Right.
kind of generic.
Right. Imagine instead of just saying, I'm meticulous, you say, I'm meticulous.
Right.
Which is why I caught that discrepancy in our patient billing system.
Oh.
And it saved the hospital thousands of dollars.
Wow, yeah.
Suddenly, it's not just a word.
Right.
It's impact.
Yeah, that's way more convincing.
Exactly.
The video also talks about aligning with the organization's values.
Yeah.
But how do you do that without sounding fake?
Research.
Okay.
Don't
Yeah.
just skim their website, right?
Yeah.
Look into like recent CMS regulations
Okay.
and see how that organization is responding.
Right.
Or if they're in like a specific region, understand the patient demographics.
Oh, interesting.
Like, are they serving a largely elderly population? Mentioning these things shows you're already thinking about their unique context.
That makes sense.
Yeah.
Now, the why do you want to be a healthcare administrator question?
Oh, yeah.
The source really emphasizes matching your goals with their mission, but that can sound so canned.
It can,
Yeah.
unless you're specific.
Yeah, okay.
So let's say their mission statement mentions patient-centered care.
Right.
You could say something like, in my previous role, I spearheaded a project that reduced patient wait times by 15%
Uh-huh.
because I strongly believe that,
Yeah.
and then tie it back to their value.
Ooh, I like that.
Yeah.
You're not just saying you align, you're showing how you've already acted on that value.
Precisely. And don't be afraid to bring in industry trends, too.
Okay.
If they're focused on telehealth, for example.
Right.
Mentioning your interest in that shows you're keeping up with the field.
Oh, that's good.
Yeah.
Okay. On to strengths.
All right.
The video lists organization, attention to detail, communication, tech skills, and flexibility. Why are those the big ones for healthcare admins?
Because you're essentially an orchestra conductor
Okay.
in a chaotic environment.
I like that analogy.
Think about it. A delayed surgery
Yeah.
impacts not just the patient,
Right.
but the OR schedule,
Mm-hmm.
staffing,
Right.
even billing.
Wow.
A good administrator keeps all those plates spinning.
So organization is about more than just like clean files.
Right.
It's about preventing system-wide meltdowns.
Exactly.
Wow.
And then attention to detail.
Yeah.
One wrong digit in a patient's chart
Oh, God.
can have serious consequences.
Right.
It's a very high-stakes environment.
Yeah, that's true.
And communication.
Well, it's got to be more than just being friendly.
Way more.
Okay.
You're communicating with doctors, nurses, patients who are stressed,
Yeah.
families, insurance companies,
It's a lot.
each needing a different approach.
Right.
Mastering that is key.
Okay, tech skills.
Yeah.
I get that healthcare is going digital,
Huh.
but can you give me an example? Beyond, I'm good with computers.
Mention familiarity with like specific EHR systems
Yeah.
like Epic or Cerner,
Okay.
or if you've used data analytics tools to improve efficiency, that's gold. Show that you're not just tech savvy,
Right.
but healthcare tech savvy.
Okay, that makes sense.
Mm.
Flexibility, though. That
Yeah.
one feels like every job wants that.
True, but in healthcare, it's amplified.
Okay.
A pipe bursts in the ER.
Oh, no.
A major donor suddenly visits.
Oh, wow.
You need to shift gears instantly
Right.
while staying calm
Oh, my God.
and keeping everyone else on track.
Now, when they ask you to, like, describe a time you managed multiple tasks, The video recommends the STAR method.
Oh, yeah.
Situation, task, action, result.
It's a classic for a reason.
Yeah.
There are examples about handling a busy clinic week,
Okay.
which is fine,
Yeah.
but let's make it even more powerful.
Okay. How so?
Instead of just listing tasks, weave in the challenges.
Okay.
So like, we were short-staffed because of X, so I had to do Y to ensure Z.
Okay.
It shows problem solving under pressure,
Yeah.
which is what they really want to see.
That's really good.
Yeah.
And that's the end of part 1.
Okay, cool. So picking up where we left off, the How to Become Video mentions a bunch of other common interview questions,
Okay.
like how you handle teamwork or stress or tough situations.
Right. And we won't hit every single one.
Yeah, of course.
But what's like the overarching thing our listener needs to be ready for?
Behavioral questions.
Okay.
They're not just asking for information.
Right.
They're trying to gauge your approach.
Okay.
Like, think back to times you had to collaborate with a difficult colleague, or when a project went totally off the rails.
Oh, yeah.
How did you handle it?
Right.
What did you learn?
Okay.
Those stories are gold in an interview.
That's interesting.
Yeah.
And the video also stresses asking good questions at the end.
Oh, for sure.
But isn't it risky to ask the wrong thing?
It can be if you ask something that they could easily just Google.
Oh, okay.
But here's the key. Your questions reveal what you value as a healthcare administrator.
Okay.
So instead of, what are your growth plans?
Right, which is kind of generic.
Yeah, try something like, how is this organization adapting to the shift towards value-based care?
Ooh, that's good.
Yeah.
It shows you're not just interested in any job,
Right.
but one that's tackling the big issues in healthcare.
Exactly. You could also ask about their approach to staff burnout or how they're using data to improve patient outcomes.
Okay.
Tie it to current industry challenges.
Now, the video mentions confidence,
Yeah,
which feels so cheesy to say,
I know.
but it does make a difference.
It really does.
How do you get that, like, I got this vibe without being arrogant?
Preparation.
Okay.
Preparation breeds confidence.
Yeah.
When you've done your research on the industry trends,
Yeah.
when you've practiced answering those tough questions out loud,
Right.
you'll naturally feel more self-assured.
It's funny, the video says to picture the interview as a conversation,
Yeah.
not an interrogation.
Right.
Which is easier said than done
Pauline,
when you're nervous.
it is, but there's truth to it.
Okay.
You're not just trying to impress them.
Right.
You're also figuring out if they're a good fit for you.
Oh,
Do their values resonate with you?
okay.
Do they align with your career goals? Thinking that way takes some of the pressure off.
I like that.
Yeah.
So instead of feeling like you're begging for a job,
Right.
it's more like two professionals seeing if they can work together.
Exactly. And remember, everyone gets nervous.
Oh, yeah.
The interviewer knows that a little
Uh-huh.
nervousness shows you care. Just don't let it hijack all your prep work.
All right, so let's recap our deep dive here.
Okay.
We've gone way beyond just those basic interview tips
All right.
from the video.
Yeah.
We've talked about tailoring tell me about yourself, to be more impact focused. We've talked about researching the organization beyond just the surface level. Yes.
Connecting your strengths to the real challenges of healthcare administration.
And asking questions that show you understand the industry.
Right. Not just that you want a job.
Plus that whole mindset shift.
Yeah.
Approaching it as a two-way conversation.
Exactly. Now, before we send our listener off to totally conquer that interview,
Okay.
I want to leave them with a thought.
Okay.
The video briefly mentions being passionate about patient care.
Right?
But what does that really mean for a healthcare administrator?
Yeah.
Someone who's not directly treating patients.
Ooh, that's a good way.
Because on the surface, it seems like the admin's job is all about like numbers and systems and efficiency.
Right, right.
And it is to an extent.
Yeah.
But think about it.
Okay.
Every decision an administrator makes impacts patient care down the line,
Okay.
from staffing levels to budget allocations.
Wow. Yeah. It's almost like you need that systems level view
Right.
to truly advocate for good patient care.
That's a great way to put it, because advocating is a big part of the job.
Yeah.
You're advocating for resources, for policy changes, for staff support,
Right.
all of which
Yeah.
ultimately impacts the patient experience.
And that ties back to what we were saying earlier about connecting your strengths to real world challenges.
Right.
It's not enough to say you're organized.
Exactly.
You have to show how that organization translates into like smoother patient flow or reduced wait times.
Exactly. Think about the stories you tell in the interview.
Okay.
Are they just about you succeeding,
Mm-hmm.
or are they about how your work helped create a better environment
Right.
for patients and staff.
It's almost like a subtle shift in perspective, but
Yeah,
it makes a huge
it
difference
really does.
in how you come across.
Absolutely. And I think that's something worth reflecting on,
Okay.
even beyond the interview.
Yeah.
What kind of healthcare leader do you want to be? One focused only on metrics,
Right.
or one who understands the human impact
Yeah.
behind those numbers?
That's a great question to leave our listener with.
Yeah.
Because at the end of the day, healthcare is about people.
It is.
And whether you're interacting with them directly
Yeah.
or shaping the systems that support them,
Right.
that human element should always be at the forefront.
Well said. So to our listener out there getting ready for that big interview,
Yes.
we wish you the best of luck.
Good luck.
Remember everything we've talked about? Go beyond the surface. Connect the dots.
Yeah.
And show them you're already thinking like a healthcare leader
Right.
who truly cares.
And even if this particular interview doesn't work out,
Yeah,
the insights we've discussed today will serve you well
absolutely.
throughout your career in healthcare administration.
Because at the end of the day,
Yeah.
it's about continuous learning growth and a genuine commitment to making a positive impact.
Couldn't have said it better myself. And that wraps up another deep dive.
Until next time.